You are welcome to my channel. Thanks for visiting. Today is all about core pulmonale. But if you haven't subscribed to my channel, please kindly do. To those who are visiting again, I'm saying a big thank you. Without further ado, let's go. By way of definition, core pulmonale is a problem in the lungs leading to problem in the heart. To bring it down closer, core pulmonale is about lung diseases leading to increased vascular resistance in the lungs, now causing heart failure and precisely right heart failure. If we remember the circulatory system, used blood will return to the right side of the heart, the right atrium, from superior vena cava and inferior vena cava. The content will be pumped into the right ventricle, and pulmonary artery will pick it up, heading into the lungs. While there, exhalation of CO2 will occur, while reoxygenation will take place. But in core pulmonale, the lungs would have built high level of vascular resistance. The content from the right ventricle that would have been dumped into the lungs, because the resistance in the lung would be lower than the force coming from the right ventricle, would not be. That would be lost. So higher resistance in the lungs will prevent pulmonary artery from dumping the content as expected. So the problem in the lungs now is giving the right ventricle, a big trouble. So problem inside the lungs is causing the heart to fail, precisely the right heart, the right ventricle. I will explain further when we get to pathophysiology. So those who call it pulmonary heart disease, they are pretty right. Let's quickly examine the patho. I've said earlier, the right ventricle pumps the blood into the lungs via pulmonary artery. But that will only occur accurately without extra effort when the pulmonary artery is dumping the content against low resistance. But in core pulmonale, certain diseases, many conditions would have created a higher pulmonary vascular resistance against the content coming from the pulmonary artery through the right ventricle. So there's a problem for the content to be done. What are we going to be faced with? There'll be backflow, because there is higher resistance in the lungs right now because of the diseases found there. And the backflow will be through pulmonary artery back into the right ventricle. So the right ventricle will become dilated, thickened, and will be working against higher resistance here, called pulmonary hypertension. So the right ventricle will be failing. The heart is already failing, right heart failure. So the backflow will mean that the content will be going back to where it was coming from. So we'll pick edema peripherally in affected individuals. And some will be surprised that they did not pick heart issues in this person. This person has come to the hospital because of the problem in the lungs. Why the swelling of the feet, the face, the abdomen is distended, murmur, and everything. It's because higher resistance has been built in the lungs due to that lung problem. There's backflow instead of normal content from the right ventricle through pulmonary artery being dumped there. We have chronic cor pulmonale or acute cor pulmonale. Chronic cor pulmonale is mostly secondary to COPD, while acute is mostly secondary to massive pulmonary embolism. Let's quickly go through some possible signs and symptoms. It will be asymptomatic in many people when it is not that significant. But certain signs and symptoms like shortness of breath can be picked with cyanosis, aposic state, jugular vein will become distended, so jugular venous pressure, distension. The same thing that will lead to ectomegaly when there's backflow. Palpitations, could say lift parasternally. Then there will be loud S2 component of the heart sounds, particularly because of the pulmonic aspect of it. Then murmurs of tricuspid and pulmonic regurgitation could be picked. Edema peripherally because there is backflow. Backflow because pulmonary artery is working against higher resistance in the lungs to dump the content from the right ventricle. And like I've said earlier, ectomegaly, or from the backflow. What are the possible causes of cor pulmonale? In medicine, when we don't find the cause, we give it another name, known as idiopathic. It could be idiopathic, but in individuals with COPD, that is the most common cause of cor pulmonale, COPD. Pulmonary embolism, that will be responsible for acute cor pulmonale. Cystic fibrosis, I have a self-representation on that right here. Left heart failure, because left heart failure most of the times will be the cause of the right heart failure. Autoimmune conditions like scleroderma that can damage the lungs, leading to increased vascular resistance or pulmonary hypertension. Musculoskeletal conditions like kyphoscoliosis and certain lung diseases like bronchiectasis, interstitial lung diseases can cause cor pulmonale. We can do site investigation, chest X-ray very quickly, echo, CT, MRI, or nuclear medicine. The prognosis. Majority will survive 1 year. Half of the affected people might be 5 years, while a small percentage, like 10%, will live 10 years. It is a terminal phase of pulmonary hypertension. With that, I come to the end of this short presentation, cor pulmonale, particularly in individuals with COPD. Watch out in anyone with DVT that could throw pulmonary embolism. When it is massive, they can have acute cor pulmonale. It's a condition that could kill and could kill very fast. You could see the prognosis here. Please share this presentation with everyone. Remember to subscribe to my channel. I appreciate it.